Good morning. Thank you, Supervisor Sarmiento and the Honorable Board of Supervisors for bringing this item today. I'm Ian Kemmer, the Behavioral Health Director for Orange County Healthcare Agency. As Supervisor Sarmiento mentioned, one of the themes of this year's Mental Health Month is break the silence, break the stigma. We all know someone who struggles with their mental health or their mental wellness, or we may struggle ourselves. It's so important for us to share our stories and to bring light to this subject. I want to encourage everyone here today and those listening to focus on reaching out for yourself or someone you love and connect them with someone to tell their story. By sharing your story or by asking others how they're doing, you're letting people know that they're not alone. Hopefully, by telling your story, you're working with others to do the same. Just a short story from me the other day. During Mental Health Month, I get to do a lot of things. One of the things that I got to do was a career day. And I went into the career day, and for some reason, maybe behavioral health wasn't the top priority. They had a former baseball player, and they had a person who works at Netflix, and they had an artist for Disney. And for some reason, not everybody signed up for my behavioral health speech. But folks did come in and started to walk in, and I noticed one young lady who walked all the way over to the side of the classroom and sat by herself quietly. And I put my clinician hat on for a moment, and I realized that she was feeling sad, or it could have just been in that moment. But I decided to change things up in what I was going to talk about, and I spoke about how I felt when I was that age and my struggles with depression as a 14-year-old in middle school. And then I went on to talk about all the wonderful work that we do in the healthcare agency and behavioral health and the work that folks do. And after that meeting, a lot of kids came up to me and talked, but I noticed that this young lady waited until the end. And after everybody else left, she came up to me and she said just a few words. She said, I want to thank you for what you do, and I now know what I want to do with my life. I tell that story because it's a small piece of what we do. The folks that I work with, our behavioral health staff, our provider partners, and many of the folks up here today touch thousands of lives a day. They don't always get that immediate feedback from them, but that message and that sharing is so important and brings us together. That's what we can do. A small amount of work that our staff does, they share stories. They share stories of hope, resilience, and healing with all of the community. This brings people together and helps protect our most vulnerable folks. So I want folks to share their story, to reach out to folks that you may see that you think are in need. Ask questions, provide the resources that the supervisors have talked about today. You can visit OC Navigator, as was mentioned. You can visit OC Links, but we need to shine a limelight on, or lime green, on this issue. Breaking the silence, breaking the stigma is what's important. Every one of us can change a life for the better. Thank you.